Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're going to be doing another Kahoot and we're going to be going over skin disorders. This Kahoot has been made specifically for the nurse practitioner student. Now, if you're a PN student, a VN student, an RN student, by all means, I want you to stay, plenty of things to learn. However, it's been made specifically for the nurse practitioner student. Now, if you're an NP student or you know an NP student, please send this video to them. Send them to your classmates. Every single slide that I go over in this Kahoot, the content of that slide has been seen on the NP boards over and over and over again. If you've been following me for any amount of time, you know I do not believe in fluff. If I'm talking about it, if I take the time to make a slide about it, that means the chances of you seeing what I'm talking about somewhere in your academic career is very, very high. So go ahead and forward this to all the NP students in your life and thank me later. Before we get started, I also want to, oh, I have the green screen on. You can't see. But my book is out. Nexus Nursing's NCLEX RN NGN cheat sheets. You guys, I sold out the first night last week, Thursday night, when I debuted this book. I got a new shipment in 2 days later. You guys sold me out again. I now have a waiting list. I have not a waiting list, a pre-order list. So if you haven't gotten yours yet, make sure you grab it for the RN or the RN student in your life. They will thank you later. And I'm seeing all the messages from the PN, the VN, the NP students. Yours is coming. Next, what I'm rolling out is going to be a test bank. And the test bank that I'm rolling out is going to be for the PN, VN students. So you guys are next. And then after that, I'm rolling out something special for the NP student. And I'm working on both projects at once, and I'm not sure which one I'm going to release yet. So that's why I'm not going to say, but I have something special in store for you. So I've got a little something for everyone. Just be a little patient with me. I'm just one person and I'm trying my best. So give me a little bit of grace, okay? Don't forget, almost daily, you can find me covering content on my social media platforms, TikTok, Instagram, Facebook, YouTube. My handle is the same everywhere, Nexus Nursing. Be sure to check out my website. My website is where you can purchase the book. You can get yourself a pre-order because I'm sold out right now. You can get yourself a pre-order. And for my test bank, I have a wait list. It should be open. It should be open. If not tonight, by tomorrow, it should be up. So check out my website for that. Again, nexusnursinginstitute.com. All right, guys, without any further ado, let's get started. Skin disorders for the nurse practitioner student. First question. All right, a patient presents with multiple pustules and cysts on the forehead and cheeks. Which classification of acne vulgaris should be documented? Is it comedonal acne, mild inflammatory acne, moderate inflammatory acne, or severe cystic acne? What type of acne vulgaris are we talking about here? This is skin disorders for the nurse practitioner student. Yes, this is for NP, not for RN, not for PN, not for VN, but you'll still learn, so don't leave. Okay, so let's talk about it. The correct answer is moderate inflammatory acne. What I'm about to say to you is just my personal opinion. NP is not as hard as RN or PNVN. And the reason for that, PNVN and RN, there's so much critical thinking involved. With NP, you have guidelines. It is what it is. I'm not saying there's no critical thinking, but it's nowhere near as much as you have with RN, PNVN. So I'm telling you, if you're doing PNVN, RN, don't be scared. Keep going. It gets easier. You see this question? Let me tell you something. The minute you saw these two words, pustules and cysts, you see them together, you already better be thinking moderate inflammatory acne, especially if they say forehead and cheeks. That was your giveaway, pustules and cysts. Okay. Now I'm going to tell you the giveaway for the other options because you might see the other options on the test. So let's do comedonal acne. You see that one. Um, you'll see descriptions such as blackhead, whitehead. If you see blackhead, whitehead, that's what they're talking about. That comedonal acne. If you see for mild inflammatory acne, if you see papules and pustules, most likely they're talking about that. And last, severe cystic acne. Um, what word do they use for severe cystic? For severe cystic, you'll see scarring. So the acne's so bad, it causes scarring on the skin. The minute you see the skin scarring, that's what they're talking about, the severe cystic acne. Okay, so make sure you know all four because I don't know what they're going to give you on your exam. Next question. A teenage patient with acne asks how often to wash her face. Which instruction would be correct? Wash the face vigorously once daily. Wash gently 2 to 3 times daily with mild soap. Wash every hour with an astringent or wash only when breakouts occur. The code to get in is 679064. 679064. Okay, very good. Wash gently 2 to 3 times daily with mild soap. Gently, 2 to 3 times mild soap. Those are the three things you need to remember when it comes to skincare. Let's look at the wrong answers. What made the first one wrong? Vigorously. Do we do anything vigorously? No, they can harm their skin. Next, wash every hour. First of all, number one, every hour, guess what you're going to cause? Dryness. And you're thinking, okay, how can water cause dryness? Well, the more you wash your face, the more you're going to cause dryness to the skin. That's number one. And number two, with an astringent, that's way too harsh. Absolutely not. And then last, what word made that wrong? Only. Do not choose an answer if it has an all inclusive, such as only, always, never. That is not your correct answer, okay? Uh, an adult female with a comedonal acne is prescribed tretinoin cream. Which teaching point is most important? So we're talking about tretinoin cream. Which teaching point is most important? Apply in the morning after moisturizer. Apply to dry skin at bedtime. Combine with benzoyl peroxide or apply multiple times a day. You have a female patient, they have comedonal acne, and you are prescribing tretinoin to this patient. What are you going to teach them about this medication that you just prescribed to them? What is your answer? Very good, Aries. I see you. Very good. Apply to dry skin at bedtime. Some very important things you guys have to know about this medication. Um, an adverse effect is photosensitivity. So it makes sense have them do it at bedtime so they're not going out in the sun. That's number one. Number two, why dry skin? Well, absorption is increased on dry skin with this particular medication. Dry skin increases absorption. And number three, most importantly, when do you think skin rejuvenation happens? Skin rejuvenation and regeneration, when does that happen? At night when you're sleeping. Those are the top three reasons why it needs to be applied at night to dry skin, okay? Okay, a 19-year-old with moderate acne is prescribed benzoyl peroxide. Which counseling would be correct? It may cause permanent skin discoloration. Take this medication on an empty stomach. This drug requires a regular CBC monitoring. This medication may bleach fabrics. You just prescribed benzoyl peroxide to your patient. What are you going to teach them about that drug? Very good. This medication may bleach fabrics. You have to teach them that because if they have beautiful blue or yellow towels and they use the towels, guess what? It's going to bleach that towel. So you're going to warn them. So just use white towels because it can cause bleaching of fabrics. It doesn't cause permanent discoloration. It may cause a temporary discoloration when the patient just starts using it, but it's only temporary. Why would you tell them take it on an empty stomach? It's not something they're ingesting, it's something topical. And no, CBC monitoring is not necessary. Now, here's something else you're going to teach a patient. You're going to tell them that it may cause local irritation once they first start using it, but it's not going to cause something systemic that monitoring such as CBC would be needed, okay? By the way, this also is a very common topical medication given for things like acne. Again, every single drug that is on this Kahoot has been seen on boards very often. Make sure you know it. Okay, a 23-year-old female with acne is prescribed I can't speak. Tazarotene. Which precaution is essential? Avoid dairy products. Take only with food. Use two forms of contraception, or use with sunscreen containing para-aminobenzoic acid. What do you guys think on the live? Use two forms of contraception. Let me tell you something. This drug is pregnancy category X, which means it's teratogenic, which means if you prescribe this to your patient without doing an HCG, you did not confirm that this patient's not pregnant. You prescribed this to the patient, you could lose your license. Category pregnancy category X, teratogenic, okay? If the patient is pregnant, this drug is contraindicated. So yeah, you cannot get pregnant. Go ahead and use two forms of contraception. Let's just make sure. And you better run an HCG before prescribing that to your patient. A patient using azelaic acid for acne reports hypopigmented patches. Which population is most at risk for this effect? Would it be adolescents? Would it be patients with darker skin? Would it be elderly patients? Or would it be pregnant women? Azelaic acid, okay, it's given for acne, and patients report hypopigmented patches. Who's most at risk for this happening to? When you prescribe this drug, who are you going to be careful about prescribing this drug to? Because there's so many drugs on the market. Why would you prescribe it to this class when you can prescribe something else? And your state boards expects you to know that. This is how they want you to think. You can't be out here just prescribing anything willy-nilly. Very good. Patients with darker skin. Here's the thing with this drug, it it acts, I'm saying the wrong word. Counteracts, I should say. It counteracts with melanocytes. So you know how you have melanin? That's what makes your skin beautiful and dark, right? So it counteracts with that. So the darker that you are, the more hypopigmentation that you're going to have. So this is not something. Sorry, guys, are you there on the live? Sorry about that. My son just tried to FaceTime me. Um, what was I saying? I'm sorry, I forgot what was I talking about? Oh, yes. So if the patient is highly pigmented, this is not the acne medication that you prescribe. You prescribe something else because you don't want it to cause hypopigmentation. And that hypopigmentation, it doesn't go away. Okay. I mean, it can, but it rarely does. A 15 t- a 15-year-old is prescribed Topical clindamycin. Which adverse effect requires discontinuation? Would it be mouth stinging at application site, photosensitivity, hypopigmentation, or diarrhea and abdominal pain? Oh, you guys are all over the place. Okay. Diarrhea and abdominal pain. Let me tell you something. The minute you see your test question mentions this drug, clindamycin, topical clindamycin. First of all, this is a separate question, but there's a famous question they ask on the boards where they just want to know, do you know like what condition this drug treats? So you need to know, acne, psoriasis, you got to know indication. But back to this particular question, you are going to be concerned about pseudomembranous colitis. The minute you suspect pseudomembranous colitis by things such as diarrhea, abdominal pain, immediately you're going to discontinue that drug. You're going to discontinue that drug. This is severe inflammation of the colon. That is an adverse effect. Okay? Okay, which antibiotic should not be prescribed for acne in a 10-year-old child? Would it be clindamycin, tetracycline, erythromycin, azithromycin? I should have had better options. I wasn't thinking when I did this one. I was rushing. Everybody should get this right because I wasn't even paying attention when I was doing this one. I can't believe I did that. But that's okay. This is a teaching moment. I'll use it as a teaching moment. Very good. Tetracycline. This is multiple choice. Only one can be the answer. Notice clindamycin, erythromycin, azithromycin. Why would you choose one of those? And it's a multiple choice. Only one could be the answer. Choose the oddball. Tetracycline. Duh. All right. What do you need to know about tetracycline? This is an antibiotic. You better not prescribe this to any child that's younger than 12 years old. You mess around and lose your license. Okay. Why? Because it's very harmful to their developing teeth and bones. Okay. So it's contraindicated in any child that's younger than 12 years old. True or false? The most important monitoring for a male that's prescribed isotretinoin is liver function tests and triglycerides and HCG if female. So the most important test, if you're ordering isotretinoin for a male, you have to get LFTs and triglycerides. And if she's female, you have to get HCGs. First, before you prescribe it, you got to check to see those levels. Is this true or is this false? For the male, it's the LFTs and the triglycerides, and for the female, it's HCG. Is this true or is this false? True. True. When you see this drug, the depending on the question that you get, if it's a male patient, you're going to be concerned about hepatotoxicity. So you better be checking those liver function tests. You better be checking those liver enzymes. You better be checking the triglycerides and you better know your levels because guess what? On the NP boards, they don't tell you what the normal level is. You have to have it all up here. Okay? But you better be looking at that. And if it's high, are you going to prescribe this medication? Absolutely not. If it's a female patient of childbearing age, you better run an HCG before you prescribe that patient because you're not trying to lose your license. Okay? All right, let's keep going. How are you guys doing on the live? You guys good? Okay. True or false? Isotretinoin has been linked with depression and suicidal ideation. Is this true or is this false? Thank you, girlie. True. It's true, especially if you're younger. Especially if you're younger. Older. Guys, I don't do co-hosts on my lives. Older adolescents, young adults, especially. Let me tell you something. If you see this drug and it's because usually that's how they give it to you. So they'll tell you the patient's on this drug, but the age of the patient will be an older adolescent, young adult, and they come in and it's like a 6 week follow-up, something like that. And they say how their mood has changed. They don't want to go out with friends anymore. They don't enjoy things that they used to enjoy. What is the first thing you ask them? You ask them directly, are you having thoughts of, right, or harming yourself? And if they are, you immediately discontinue that drug and you refer them to an inpatient clinic. Immediately. That patient's not leaving your office. You're not trying to lose your license. Okay? If the question, same thing again, older adolescent, young adult, but they tell you directly that they're having thoughts, their mood has changed and they're having those thoughts, what is your next action? The first next action, DC the drug, and the next action, immediate referral for inpatient therapy. Okay? All right, let's keep going. I'm giving you gems here. A patient with rosacea presents with fixed, I can't say that word, but you see it on the cheeks. Telangiectasia. I think I said it. Telangiectasia on the cheeks. Which diagnostic statement is correct? This is a hallmark finding of rosacea. This finding rules out rosacea. This indicates bacterial folliculitis, or this suggests systemic lupus erythematosus. What do you think the answer is? The code to get in is 679-064. 679-064. But we're almost done. We're on slide 11 out of 12. We only have one more. I'm so sorry. What is the answer? Very good. This finding is hallmark of rosacea. Guys, we're on screen 11. If you haven't realized by now, when it comes to NP, I would say about 75%, maybe more, of the questions that you get, if there are certain keywords you can remember, you're going to be good to go. Let me tell you something. You see this phrase right here? Fix telangiectasia, the word I can't say, that T word. You see this right here immediately, your mind needs to go to rosacea. That's what they're talking about 99% of the time. Okay. Another question for NP boards, they like to give a lot, so make sure that you know, is this one down here. Bacterial folliculitis, you need to know that as well. So that is like infection or inflammation of the hair follicles. And so the word or the words they like to use when it comes to bacterial folliculitis, they'll use words like oh my gosh, I can't, I'm getting brain fart. What's that word for redness? Guys, what's that word for redness? It starts with a E. Oh my gosh. Hello? Yes, thank you, erythema. Thank you. So it'll be described as erythema or erythematous pustules. Erythematous pustules. Most important, located where? On hair follicle. The key word is hair follicle. Hair follicle is going to be there. Why? Because when it comes to bacterial folliculitis, that's what it is. Inflammation, from infection of the hair follicles. But so you're going to see hair follicles, you're going to see redness or erythemat, I can't say that word, erythematous and pustules. Those three, when you see them together, that's what they're talking about. They like to ask about that a lot. Make sure that you know it. All right, one more. True or false? That drug, I'm not going to try to pronounce it, is contraindicated for anyone on anticoagulants. What drug is that? Do you guys know what drug that is? You got to be kidding me. Thank you. Flagyl. It's an antifungal agent. It's contraindicated for anyone on anticoagulants. Is this true or is this false? Jacob, I'm gonna fight you. I'm gonna fight you too, Brenda. True. I don't know why everybody on the live was saying false. This is true, and you need to know this. Because what they're going to do, they're going to tell you that the patient came in and you're about to order this drug, or that you just ordered this drug and you happen to see their chart, or you're looking through something, and they'll give you a whole bunch of information, and they will hide it right in the middle of all the information that they give you, that this patient's on Coumadin or there's some on some type of anticoagulant. That's a problem. Why? Because this drug potentiates anticoagulation. You gonna mess around and have this patient bleed out on you. Okay? All right, that was the end of this Kahoot. Let's see how my NP students did.